Hi, everyone, and welcome to today's webinar, Strategies to Support Trauma-Exposed Healthcare Workers. I'm Mackenzie Bean, Managing Editor with Becker's Hospital Review. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is also being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it is my pleasure to turn the floor over to our presenters to introduce themselves and begin today's presentation.
Great, thank you. I appreciate that quick introduction, and I'm glad to kick us off. My name is Dr. Joe Grasso. I'm a clinical psychologist by training, and I'm glad to just introduce everyone to this topic that we're going to be speaking on today, strategies to effectively support healthcare teams exposed to trauma. So we know that even in the best of circumstances globally, individuals who work in healthcare may be exposed to trauma at disproportionately higher rates compared to other occupations. But this has been an unprecedented year where trauma has been a part of the everyday picture for many healthcare workers. And so in this presentation or Q&A, we're going to learn from some leaders in the field who have been supporting their workforces in addressing some of the mental health fallout from the life-disrupting events of the past year. So with that, I want to go ahead and introduce our panelists. So first, I'll just briefly introduce myself. My name is Dr. Joe Grasso. I'm a clinical psychologist by training, and at Lyra Health, I am the Director of Workforce Mental Health. So I oversee the development and delivery of our educational content, and I consult with employers on workplace mental health strategy. And I'd love for our other panelists to introduce themselves. So starting with Katie.
Good afternoon, everybody. I'm Katie Davison. I'm the Chief Human Resources Officer for Mon Health System. We have several hospitals and physician practices here in North Central West Virginia. I am currently in Morgantown, West Virginia, by way of North Carolina, where I'd spent the prior 10 years with the University of North Carolina Healthcare System at one of our community hospitals located in Rocky Mount. So pleasure to be here this afternoon.
Great. Thanks, Katie. And how about you, Corey?
Hey, Corey Jackson. Thank you all for having me here today. I'm at the University of California, San Francisco. I am the Chief Human Resources Officer, both for the health system and then also for the university as well. We have roughly around 38,000 total employees here in the Bay Area. And previously, I was at Parkland Hospital and Health System in Dallas. And before that, worked at George Mason University. I used to practice law in a lifetime ago as well in the DC area. But it was really great to be invited to this. I'm looking forward to the discussion.
Excellent. Thanks to you both. And I'm sure that our audience members are really eager to hear from you, but given your positions and your unique perspectives on supporting healthcare workers during the past year. Before we dive into a little bit of kind of foundational knowledge so that we're all on the same page in terms of the scope of the problem, I want to give a quick introduction to Lyra. So Lyra is the company I work at. We are a comprehensive mental health benefits company, and we support employers and their workforces by providing access to comprehensive mental health services in ways that reduce barriers to getting into care and ensuring that folks access the right care that's effective for them. So that means immediate access to care that's tailored for an individual's needs based on a robust clinical triage assessment. And we are able to connect them to a range of services depending on those needs, meaning that we support treatment for everything from day-to-day life stressors all the way up to more severe and persistent mental illness or severe conditions like suicidality. We have been able to demonstrate that our care programs are effective. So we collect clinical outcomes data and have published that data in peer-reviewed journals. So we've been able to show that over 80% of individuals who receive therapy, for example, from Lyra, show at least reliable clinical improvement or even recovery from their conditions. And we provide this care in a way that's culturally responsive. So we prioritize the recruitment of a diverse provider network that's available nationally to meet the needs of individuals with particular backgrounds or cultural needs. and that we're also able to support the entire age span, meaning not just adults, but also children and adolescents, and also different modalities, including couples and family therapy. So with that in mind, I wanted to now transition to talking about some strategies to support healthcare teams. So some of the strategies that we're going to talk about will include ways to support around identifying the benefits that are going to best support employees through different stressors, how managers can help specifically address the impact of trauma exposure among their direct reports. And then also, looks like I'm having a technical snafu with my slide, but that third point is ensuring that there's long-term employee support in the context of COVID-19. So we know that there's likely to be a long tail effect of mental health distress even after we're in a fully post-vaccinated world. So how can employers keep mental health support top of mind? And just to support the importance of these three topics we're going to discuss, I want to talk about some of the mental health impact that we're seeing through data. Lyra commissioned a State of Mental Health report. And in that survey, that broad-based survey, we made sure to collect data from a wide range of industries, one of those being healthcare. And in surveying healthcare workers, we found that 44% of those workers were reporting dealing with one or more mental health conditions. So that number is actually higher than the national data we're seeing across all US adults from CDC in terms of number of folks who are dealing with a mental health condition. So that's trending a little higher than average for this industry. And then 54% of those surveyed said that their mental health was specifically impacting their capacity to work. So this is just a reminder that the mental health impact is not only affecting people's general quality of life, but it's also impacting their ability to function well in the workplace. And that makes sense when we think about the fact that people don't live their lives in silos. What's affecting them broadly in their personal lives can't help but spill over into the workplace. But in the instance of thinking about healthcare workers, it's likely that what was happening at work was specifically impacting their mental health. So it wasn't just what's happening outside of work is affecting one's ability to work, it's also the workplace factors themselves that are contributing to mental health outcomes. Another important data point, 12% of those surveyed said that their employers had offered some new mental health benefit in the wake of COVID-19 in order to cope with the fallout from the pandemic. And so that number, being as small as it is, tells us that even if there were efforts among employers to extend additional benefits or resources or programs to support mental health, the perception, at least among healthcare workers, is that, for most of these workers, the vast majority, there wasn't much new being done. There wasn't much change in the status quo. Another important point to bring up here is this issue of psychological safety in the workplace. We know that you can offer the most robust benefits in the world, but if employees don't feel like they can make use of those benefits or speak up when they're struggling because of the culture of the workplace, then those benefits aren't utilized and they're not able to be effective. Unfortunately, we saw in the survey that 42% of healthcare employees said that they would be either very uncomfortable or uncomfortable talking to their manager about mental health. And when you think about the scope of impact on healthcare workers in terms of mental health fallout, that's especially distressing, that there's clearly this sense of taboo or attitudinal barriers to reaching out for care, maybe because of perceived punitive response from a manager. So before we dive into the discussion, I just want to end our slide portion of this session with this quote. I think it's a really poignant quote from Dr. Mona Massoud, who's a psychiatrist and founder of Physician Support Line. Dr. Massoud said, healthcare can't just be about making patients well. We have to care for the healers too. And I think of the classic analogy of needing to apply the oxygen mask to yourself before you support someone else. The message that we get when we board an airplane, it really applies here. We have to be able to take care of ourselves before we can fully take care of others. And that's in order to make our work sustainable in the long term. So with that, I want to kick us off with our Q&A and turn to our panelists. Given the data that we just saw, I want to check in and see if you can share what was top of mind for each of you around how to support the mental health of the workforce during the onset of the COVID-19 pandemic. And maybe starting with you, Katie, because I know that you just stepped into your current role in mid-March, which is really really rough timing for you. So maybe you can share how you wrapped your mind around this problem.
Sure, and you're correct. It started right when COVID was heading towards West Virginia. It's interesting being here in West Virginia, since it was the last state that did have a COVID positive patient. So there was this sense of foreboding of, we all saw it coming and we knew it was just going to be our turn eventually. And that did happen literally 2 days after my start date. So of course, top of mind was being able to also then utilize what resources we already had in our toolbox. So I actually got my start in HR at the University of Washington. And so conversely, Washington was the first state that had COVID patients. So I quickly reached out to my colleagues there to say, what has worked? What did you put into place? What are your employees saying? And so we can learn from what other hospitals were already doing. I think one of the most important things that we had to keep in mind was also, how was COVID affecting mental health and well-being? Not only within the hospital, but of course, being a hospital, we had to operate, we had essential staff here, but it was that fear of, they had a spouse that was having hours cut or lost their job. So there was a big financial insecurity of, what does this mean for me and my family? So we were able to quickly partner with our foundation, and we were lucky that we had a community that was really rallying behind healthcare to say, how can we help? And so we established a colleague support fund. And this was something where employees could utilize foundation funds. We quickly raised about $80,000 that we were able to use for employees who may have had a job loss within their family or have additional childcare expenses. And we were able to help them with some bill payments to provide that financial security, so they felt more comfortable knowing, okay, I've got my home life taken care of. I can come in and be my best self here at work. And then, of course, doing the additional with our non-clinical staff, being able to, if they were non-essential, quickly implementing a telecommuting policy, because there was a lot of that anxiety too of at that point in time, you think back to March of 2020, there was still a lot of confusion of, how is COVID spread? Is it contact? Is it airborne? And so there was a lot of anxiety built up about being in the building. And for the positions where we were able to accommodate it, it was a very easy solution to send them home and have them be productive from home and out of the building, which then also lessened the exposure for the folks that were inside of the building.
Great. And I love that you're kind of helping us to remember that when it comes to supporting mental health, it's not just mental health benefits, it's thinking broadly about all of the things that affect people's mental health. It's parents needing to find childcare, it's the financial implications of the pandemic, it's the ensuring one's health and safety and feeling reassured that you're as protected as possible around risk exposure. How about you, Corey? What was top of mind for you as COVID-19 was setting in?
Yeah, similar to what Katie mentioned too. The pieces about improved child care and adult service care for benefits for our team members were top of mind when schools shut down, when child care facilities shut down, those types of things. What can we do to help support people during those times, and reducing the amount of time that they would be away from their families too as well, trying to think about some of those things as much as possible. We were lucky enough to partner with some of the hotel chains here in the San Francisco area to provide housing for some of our healthcare staff who did not want to go home as well to expose some of their family members who are working on the front lines during COVID. And that was really, really well appreciated. And we were able to do that. And similar to what Katie mentioned, through a foundation to help out for a lot of our employees. We were lucky enough, again, to raise over $2 million for our people as well. So it's really, 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 really helpful. And we did it in a couple of ways to do that for them. And mentioning the flexible work too, as well, to reduce the amount of exposure in the workplace. But just thinking about how people are doing so many different things, as both Joe and Katie mentioned, so many different things outside of work there. Now the teacher, now the child care person as well, they're the adult services person, they're the chef, there are all these other things that are out there. How can we help them, during their lives outside of work? And that's really the biggest thing there too. Providing some transportation that was only for our employees as well. So they knew what was going on and those types of things. So they didn't have to use public transportation, the public transportation that was still open during that time. Just trying to think of creative ways to let them know that we're thinking about them and their health and their well-being going forward. We also set up a program that I can talk about a little bit further on too, about partnering HR, partnering with our behavioral health services department, along with our IT department, to start a program we call COPE, and it's a resiliency program to help people with mental health challenges during this particular time, and being able to offer them services regardless of who their healthcare provider was or anything like that. Is open up to all staff, faculty, learners, our students as well, going through that time.
Well said. And what I take away from both of your kind of approaches is this need for a really comprehensive, holistic view of what it means to support really not just mental health, but wellness, and this recognition that financial health, mental health, physical health, it's all intertwined. And so it seems like both of you were trying to address all of those issues as kind of under the same entity of employee well-being, and coming at it from many different directions. I'm curious specifically, you talked a lot about programs and services that were offered in response to some of the particular aspects of COVID-19 and the concerns about risk and financial fallout. I'm also curious about how you evaluated your employee benefits. Did you kind of go back and review, what are we offering in terms of benefits, and what changes might we need to make, or even if we're not changing the benefit itself, the way we communicate about it in order to tailor the benefits suite to this moment in time for employees? Maybe starting with you, Corey.
Yeah. For us, we're part of the University of California, so it's a little tougher to go with changes to our entire benefit structure there, because it affects 10 campuses and 5 health systems here in the state. So then we had to look at what could we do locally to make changes. And the first thing we wanted to do is communicate all the things that were available to folks. Oftentimes people don't know what's available until they really need it. They're not looking for it. So we made sure we had a pretty robust communications campaign to say, here's what's available right now at your disposal for you to check with, and great points of contact for them immediately, so who they can reach out to and talk to a person. Yes, some things can be done online, but with a lot of anxiety that's filled during this particular time, people wanted to talk to another person. So we had those materials and resources available to them. Then what we did is try to look at it locally. What could we do from our particular perspective in terms of some of our benefits or things that we can offer? So expanding leaves, thinking about work schedule flexibility, all these other kinds of things out there to help people. We did do a pulse survey too with our workers to find out what's top of their mind as well. But we may think in HR or leadership may be very different than what's going through their minds as well. So surveying them, and for them, it also gave them a voice to feel like, hey, they're listening to me. Here's some things that were presented as well during that time.
Yeah, great. And how about for you, Katie? Similarly, did you have the same limitations in terms of how you thought about benefits? Was there more flexibility there, and how was communication around benefits impacted?
Right. And then we saw a lot of success with the telework flexibility, but of course, recognizing that was only impactful for our non-essential staff, realizing that we had clinical folks who were also having that need for flexibility. We put into place a weekend option program, which had worked very well at prior organizations that I had been with. And what we were able to do is mix the staffing along with a benefit to where if we had, it was a modified Baylor plan to where if a clinical person working a 12-hour shift would work over the weekend, we would pay for 40 hours and allow them to maintain full-time benefits. And then that gave the flexibility during the week to adjust to the ever-changing school schedules. Because here in West Virginia, it seemed like with less than 24 hours notice, it went from in-person to remote and back again multiple times, which of course, you can only imagine was a struggle for parents, but specifically the employees we had who were single parents and trying to juggle all of that. So that was able to provide kind of best of both worlds where they could maintain and keep them whole in terms of benefits, but have some staffing flexibility. Another area we added to was expanding our EAP resources. Of course, we had those in place at all times, but like Corey, really wanting to make sure we had that presented and reminding people of the EAP resources. And then we, to Joe, your point earlier about there still being a little bit of that stigma when it comes to asking for mental health support. A program that we put into place for our system was in partnership with our chaplaincy program. So recognizing that we have a number of employees who are more spiritual and felt more comfortable in terms of having a voice and a way to communicate with our chaplains, they partnered with local Masters of Social Work students at that master's level who were able just to do a program we called Listening Hearts, where it was just a voice on the other end of the line. They were also able to round throughout the hospital and just truly do that, provide an ear for our employees who were managing through the pandemic. And so it was a way just to be able to have both options there for people to utilize what they felt most comfortable with.
Yeah, excellent point. And I think you touched on something, which is that it's communicating out about what you already have, and then also kind of tweaking programs to make them a little more effective or a little more relevant, or relying on resources that are easy to kind of plug and play in these situations. And also going back to that point about thinking holistically, well-being also includes spiritual health as well, and recognizing that that's a real source of mental health support for many individuals. So it's clear you're kind of thinking in this comprehensive lens. Along those lines, I'm curious about how you thought about different programs or different comm strategies for different roles within the organization. So, for example, the role of managers and how the guidance that needs to be provided to them might differ given that they're people leaders. So can you share a little bit about how each of you conceptualize the role of managers in supporting employee well-being, and how you kind of try to equip them to support employee well-being during a stressful time? Maybe starting with you, Katie.
So that was very critical to getting not only our employees, but the leaders who were leading those teams to understand their role in managing through this pandemic. I think they were very more comfortable definitely on the clinic side, but we need to make sure that we weren't neglecting the people side of getting through what we went through this past year. And really what we emphasized, and starting with our executive team and leading the way of never asking our employees to do anything that we ourselves weren't willing to do. So we made sure that we were present and rounding, and then with our leaders really leading by example. So we had them, so one thing we did implement from a safety standpoint was employee entrance screening, the symptom checks, the temperature checks that many of you are familiar with. And instead of staffing that with a new hire or somebody from the outside, all of our leaders signed up for shifts. So every morning at 5 a.m., we had 2 leaders stationed at the employee entrance, not only doing the temperature and symptom checks, but having that visibility of that first line of sight. Thank you for coming in today. We're glad you're here. Let's make it a great day. And so leading by example. And I think the best way that we could prepare them to really be able to help, because that was a big question of I don't know what to do. I'm not sure what to say. Nothing seems to fit right. I'm scared myself. It was really just getting them comfortable with getting back to their roots and knowing what it is they're good at doing. So one strategy that we utilized, which we needed for staffing as well, was having our leaders scrub in, making sure that if they were leading those clinical teams, they were there side by side in their scrubs, handling patients, restocking shelves. And it was a way, I'm here beside you with this. We had folks that were from non-bedside positions in our quality department, our risk department, jump right in as well. But then it also provided that they were then on the front lines and really being able to see what are the challenges, where are the struggles, and have that just-in-time intervention of, all right, we really need to rethink this process, or I've got a group here that just went through a very difficult patient loss. Let's make sure we rally and get them the support that they need.
I love that. So it's both being on the ground and attuned to what's happening on teams and being able to respond in the moment, but also this modeling of, look, we're all in this together. This is not a hierarchical approach to meeting the moment. We are all kind of, rolling up our sleeves and doing what needs to be done. Yeah, exactly. How about for you, Corey, ways in which you were trying to support your managers in stepping up around ensuring wellness of teams?
Yeah, I mean, as I mentioned earlier too, the access to information is key in a lot of different mediums. Of course, we had a COVID-19 website with a lot of the things there, but we also had things in a podcast. We had things in videos. We had e-courses that are out there, how to lead hybrid teams in terms of some people always being on site and then some people now being remote. Those kinds of things, financial sort of resources, how to talk about finances with your team during that time. We have part of the learning and organizational development materials. We had some things about responding to crisis and a section full of those things for managers. We also had some things I mentioned around financial health. And then some things too around racial injustice too. It's the things that were happening over the summer as well, and providing resources for people to talk about some of these things, because these are also intertwined. If you have a very diverse staff, all these things are sort of coming together in different parts of the organization with COVID, with protest, with issues around racial justice, how to talk and manage through some of those things as well, coming together. More recently, we've kind of moved some things from a COVID-19 website to a more sort of traditional HR website, where they can still have materials and training there too as well. We also initially had town halls that were open for leaders to go to find out information about basically what we know, what we don't know. We had our expert epidemiologists are on there and things like that, talk about things that are happening. So they felt they had that kind of information to relay back to their staff members too as well, so they can hear what's going on across the Bay Area, but then also across the country regarding some of the issues. And then for them to just feel comfortable, if you don't know something, then say you don't know it as well, because there's a lot of uncertainty during this time and a lot of complexity. I mean, for those people who are familiar with the whole VUCA model of volatility, uncertainty, complexity, ambiguity, there's a lot of uncertainty and complexity to the COVID-19 issues that are out there. So that with that is a lot of anxiety around a lot of things as well. So it's okay to say you don't know, but for us to try to find out ways to get information as well to people in the best ways possible. So those are some of the things that we were trying to do, but the town hall was really effective. It was weekly. It was for people to come on and hear from the experts in the fields, but then also hear from some of us as HR leaders, people in the finance area about how it's affecting finances, all of those things in one place where people can get that information. And it was recorded for those people who are on site or in the field or doing things like that, could go and then see that town hall on a weekly basis at their own leisure.
I really appreciate you bringing up the importance and value of programming, live programming, and then also on-demand available training. And this is something that in my role, I work with employers a lot around is having training in place that kind of spotlights the mental health aspect of a lot of these issues. You touched on how multifaceted these issues are. There's the financials impact, there's the physical health impact, and obviously the concerns about risk and the trajectory of infection rates. then there's also this mental health component. And so a lot of what I do in my role is helping equip people leaders and managers with tools to help address signs of struggle or distress in their teams, and hopefully even be proactive in creating a team culture so that people feel like they can speak up if they're struggling or having a hard time. It's clear that they know that they can ask for resources or at least direction on where to go if they need that help, and that there's kind of this reassurance in place that there's not going to be a punitive response if they're needing that help. I'm just curious for either of you, when it came to training that was made available to teams and maybe managers in particular, how did mental health get featured or spotlighted or become a focal point in the just-in-time training?
Mm-hmm. Well, for us at Mon Health, it was the topic. We did Development Institute system-wide for leaders. On piece of that was understanding exactly what Corey had mentioned, not only COVID, but the number of other stressors that were going on in the political environment in the world, as well as just even internally. We're still a hospital group that's systemizing and growing. So there are our own challenges that we're having because work still needed to get done on top of managing through a pandemic. And so when we talked about resiliency, it was very important to stress to the leadership to understand what does that really mean. It wasn't about having a thick skin. It wasn't about, saying you're not allowed to have emotion or you just have to power through it. It was recognizing that those emotions exist. And especially in healthcare where, empathy is what makes us better healthcare providers, and the people we work in healthcare for a reason. So it's recognizing what those emotions are, the trauma, the stress, the daily struggles that we face in the healthcare environment, but then how as leaders do we help people get through that? And so we looked at a multifaceted approach of having practical tools of, very quick and easy kind of TED Talk abstracts that they could pull from where if they didn't have time to sit through a more intense training. But it was really more too about the reframing of the way to get through in terms of positive thinking. And so we also shared, and this was developed at the University of North Carolina healthcare system, the 3 good things model about how you can easily look for the good when it comes to just reframing the way that you're facing the day. So it was something that we needed our leaders to do themselves. And then, as we mentioned, model the way and help their teams kind of reframe. So when they're rounding with purpose, we have clinical leaders who are experts at rounding on patients. It was really helping them understand we also need to round on our own teams. And there's a big difference in the approach versus, tell me what you would have changed about your day. How can I help is a very different conversation than kind of the drive-by rounding that I think we sometimes fall into that cadence.
Yeah, well said. And you're not only changing behaviors, but you're kind of changing perspectives, like the mindset. Corey, you highlighted, which I really appreciated, that over the past year, it wasn't just COVID as a driving stressor. There was also this overdue spotlight on racial injustice, and your healthcare system provided training and programming around that. I'm curious, what resources did you leverage to make those trainings or programs available, given that they're not firmly within the healthcare provider wheelhouse? I'm guessing you had to reach out for support on that.
Yeah, most healthcare organizations, they probably have someone who's part of their diversity, inclusion, or equity programs that are out there and leaning on them to help with some of the trainings around some of those things. Most of our leaders or managers are hired for their technical expertise and some of those things, and venturing out, whether it's COVID, whether it's racial injustice, whether it's the political issues that were going on in 2020, not necessarily well skilled in how to have those kinds of conversations. So working with those groups have been really, really key as well. Our buds as well, in terms of working with them. As I mentioned, we had the co-program that was really, really successful in partnering with other parts of the organization. Those are some of the main things there that were helpful, and people really, really loved hearing from the leaders about these issues too. So that was another thing, is whether they were at town halls, whether there were emails that went out from leaders, not only just about COVID, but about some of the other issues that were happening out there, and the response, and what the response of the health system would be in terms of some of those things. And how, for example, some of the racial injustice things ties to health equity and what we're doing around health equity, so they can see that we are front and center with some of those things. That helps people feel good about the organization that they work with. So we talk about some of those mental health things too. People want to feel good about who they work with. They want to feel secure, especially during a time where, again, there's a lot of uncertainty. And they're like, this is a part of an organization I want to be with going forward, because I see that they are doing a lot of different things that are important to me.
Well, and what I like that you stress there is the value of receiving these messages from the top, or from influential or key leaders within the organization, seeing that they've bought in and that this is important to them too. You know, that's reassuring to you as an individual contributor that, oh, this is something that the organization values. It values it at the highest level. It helps me to feel better about my employer, and that our values are aligned. So I think that's really key. That's something that we counsel our employer partners on a lot, is the value of executive testimonials as to the importance of mental health and the normalization of accessing mental health treatment. You know, I know a lot of what we've talked about in terms of the programs launched and the resources that you made available to employees, it has been, you know, a lot often in the context of the onset of the pandemic, or the early stages of the mess that was 2020. I'm curious how the strategies evolved over the past 15 months. How's your thinking about resources to make available, programs, policies, benefits, changed over the course of the year, and kind of where you're at this point, starting with you, Corey?
Yeah. With us, you know, it's constantly evolving, especially here in California. You know, we're one of the last states to sort of open up everything, and still it's not even there now. That would happen in sort of mid-June. For us to think about sort of the needs, and using some of that information from the pulse surveys along the way, to help, and then publishing that information so people can see it too as well. Here's what you said in the surveys. Here's what we're trying to do. Here's some things that we're trying to change going forward, and just try to listen. And it is an evolution. It really is. Finding out there are things that, you know, schools are not reopening here, childcare, adult care facilities, things like that. You know, those are the constant evolution with some of those things that are happening out there. And I would probably be remiss if I didn't mention, which is kind of, it can be taboo in certain healthcare circles, but there's a book out there called Patients Come Second, by Barrett, I believe, and I've given that to a few leaders, not spread it publicly, of course, because, you know, it can be taboo in health systems for a lot of
provocative title. Yeah,
it is, but you have to. It goes back to taking care of those people who take care of the patients, and ways that you can do that to sort of influence that. One of the other things tied to that I kind of took from that book as well is we've kind of enhanced our recognition sort of program throughout COVID-19 since the beginning of that, figuring out ways to allow people to express their recognition for each other, whether that's through a video or a Zoom, or having one of the leaders pop into you know, one of the rounding things and just focus on the recognition for people in that way. That has sort of changed and evolved since COVID. So that's one of the things that's kind of mentioned in that book, how you recognize your people. And we just have to think about different ways of doing it, especially with the limitations of COVID-19. But I think it's a great book in terms of just really thinking about, you know, caring for the people who are caring for those within your health systems, and figuring out ways to recognize and celebrate their achievements.
Mm-hmm. Yeah, well said. How about for you, Katie, what that evolutions look like?
You know, it's been interesting. I think a silver lining with COVID was just seeing the success of telework. I think that was new for the organization here. And then to see that during COVID, it worked. We've transitioned a number of positions to being full-time, because now it opens up our candidate pool to where you no longer have to relocate unless you would like to. So that's been a kind of a positive that we've seen evolve and definitely is here to stay. And I think from the benefit side too, we were very, very mindful throughout COVID and even now going into our new fiscal year of that financial impact, and knowing that even though many of our own employees may have delayed care during COVID and that we may see some increase in our healthcare claims for this upcoming year, we made a conscious decision to hold our healthcare premiums steady. We didn't have any increases to the premiums. We did not have any increases to copays, deductibles. Where we had control to keep things as normal as possible, we wanted to, and just really recognizing too, having to build back in the budget and making sure we continue to look at market increase and raises and having those kind of that financial health again perspective. So, it's continuing to evolve. One of the things we're looking at now is also our attendance policy. I think, in healthcare, we all struggle with that balance of we operate in 24/7. We need people to be at work because you have to have these handoffs and keep things going for the care of the patients, but also then recognizing we don't want people to come to work sick. I think gone are the days where, people would come to work with colds, and we really want to discourage that, especially when you have, we know COVID's going to be here to stay. We know we'll see a resurgence with flu at some point. So we really want to be cautious in looking at, are we too strict? Are we too loose? And where's that happy medium of needing to keep our operations running, but wanting to make sure that we also have that buffer to where people are taking care of themselves when they're also physically ill, as well as that mental health aspect.
Mm-hmm. Well said. And, I think a lot of some overlap, but also some really distinct ways of thinking about the evolution of what you're offering. It's evolution in terms of your programs and your the ways in which you're training and equipping folks, and then also recognizing this transition in terms of remote work, which we didn't even really get to dive into much, but you're also helping people through the adjustment of how they do their work in some cases. But it's really helpful to hear from both of you about how the strategy's kind of evolved over time, where you're at now. I wanted to switch gears to talk about looking forward and specifically around addressing the impact of stress and trauma, given everything that we've learned over the past 15 months. So based on everything that we've learned about how mental health can show up for healthcare workers in the workplace, how that affects your long-term workforce strategy, what you think about moving ahead in terms of what you'd like to line up in the long term for supportive resources and programs, or possible changes at some later point to factor in stress, trauma, and other mental health aspects of the employee experience. Starting with you, Katie.
So one of the things that was really important to us, partnering with our chief nursing executive, was really looking at burnout. So hearing a lot from our staff, especially those that were on the COVID unit, not only the physical stress, but the emotional toll that it took, and really thinking creatively about how can we build in, as a retention tool, just some non-traditional roles where we can still retain nurses who are extremely experienced, knowledgeable, but maybe in that spot where they're 3 to 5 years out from retirement. And they're at that point where they're trying to decide for themselves, do I need to step away or can I tough it out for another few years? And just providing that alternative. So one of the things we're exploring for this upcoming year as part of our clinical ladder implementation, but is also looking at a mentorship project with our new graduate residency. So can we utilize nurses who have that experience and do a hybrid role where maybe they're doing 1 or 2 shifts that are bedside nursing, and then 1 shift that is really dedicated to that knowledge transfer and that mentorship of our newer generation of nurses that are coming in, to be able to bridge that gap and provide a little bit of that relief. Because sometimes that's what you need is, we all talk about having those mental health days, but we really want to normalize, taking PTO for no reason at all. You don't need to give a reason for taking that day off. That's your time. But then also being able to build that into our positions to where even having a day kind of away from the environment, but where you're still being able to be productive and add value, can we look at having some of those positions created to really help with retention and then easing of that daily burden of the mental impact.
Mm-hmm. Great, great. And I love that idea of having staffing that's kind of focused on these issues, but has also had the lived experience, so these are like in the case of your nurse example, they know what the stressors are, so they're best equipped to kind of validate that and provide some intervention. How about for you, Corey, what you're thinking about in the long term moving forward to support employee mental health?
Yeah. What I've tried to do is look at our employee wellness sort of overall rollout of that across the entire organization. I shifted some things in HR in terms of our structure to really have a focus on employee wellness. The funny thing is, the ironic thing, I guess you want to say, is that I had planned to do this in January of 2020 and started working on it. And it just became actually a necessity, I think, from that point forward. So we kind of got a little bit of a head start on that and just focusing on that employee wellness thing. So what are all the resources across the entire enterprise that kind of touch on wellness? And then be strategic about it, because what I found is that they tend to be sort of tactical or reactionary in some areas, but what's our strategy around employee wellness and how can we use that as a tool to show that we're different from our sort of competitors in a way? When people think about some of the other things that other places maybe pay them more or things like that, what are some of the things that say, yeah, they may be able to pay you more, but here's what you get from a holistic approach to what we think about you as being our prized asset here for our organization, and focusing on that employee wellness piece. And so pulling all of those resources together in one sort of umbrella, the majority of it with under HR, and how we can have a strategy around employee wellness and not just be sort of reactionary or have it just be programmatic or things like that. It needs to be a strategy, and for people to see that this is what our employee wellness strategy is and what it means for them.
Great. Yeah, taking a strategic and holistic approach to wellness. I wanted to segue from that point before we get to the Q&A, the live Q&A from our attendees, hoping that you can leave folks with one actionable recommendation or tip. If there's one starting point or one maybe light lift, high impact thing that managers, people leaders, HR folks could be doing to support employee mental health, what would that be? What would that one actionable tip be? How about you, Katie?
Mine's easy and it's free. So, and it's really, like I said, looking for the good. It's how you're framing issues as a leader. So you may be short staffed, you may have 2 call-offs, but it's, wow, what a great team we have that's really come together. Something, how are you projecting the current situation that you're going through?
Great. And how about for you, Corey?
Yeah, what I feel like it doesn't cost a lot of money either, in terms of I would do periodic pulse surveys with your people to find out what they need, because that, one, helps them feel empowered, and then 2, that people are listening to them, and then show, yes, we heard you. Here's what we're doing in terms of these areas, or here's what's available. Here's what's changing because of what you said as well. That helps people feel like they're involved, and that leadership is listening to the needs of the people there. That's one thing. And then also tying it back to your values as an organization. We're doing this because of our values and we value you as well. I think it's always a good thing.
Great. Yeah. So looking for the good, listening to your people, collecting information from them that helps inform change, and then showing them how things are changing in ways that line up with company values. Great. And again, free strategies. That's the best of all worlds, easy and free. Well, great. So with that, I'd love to open it up to questions from our live audience. It looks like we've already had some questions come through. Let's see. We had one question about where did the statistic come around burnout related to COVID come from? So that came from Lyra's State of Mental Health report. So that was a survey that we commissioned of the U.S. workforce in terms of the mental health impact over the past year. And that report is available on Lyra's website, lyrahealth.com. Hope that's helpful. Let's see, another question. Let's see, have either of your organizations, or maybe, I know that you said that your organizations have, but maybe speaking a little more specifically to the support offered to parents or caregivers and what that looked like. Katie, starting with you.
Sure. So we were fortunate that at our flagship hospital, Mon Health Medical Center in Morgantown, had a local on-site daycare, but it was open to general public as well as employees received a discount. So when the state started to shut down, there was kind of this domino effect where if we had employees who were using other daycares, those were no longer available. Then we also had a shift in our daycare census where people that were then working from home were able to pull their kids out and have them be at home. So we had to quickly just adjust to and decided that we really wanted to prioritize and have those spots reserved for essential staff who were required to report to work. So it was a little bit of a lift and shift in terms of making sure that we could advertise that out so people who had lost care otherwise could get in very, very quickly at a discounted rate. And then we also worked where unfortunately, again, we had some issues on the financial side of maybe a secondary income was lost, and we had to then partner with, we have a wonderful director for our Mon Kids facility and was able to utilize some of those COVID resources that were available by our local and state governments to then help provide subsidies for essential workers that needed childcare coverage. So we were then able to even reduce or get some for free to support those workers. So, and it was greatly appreciated. We recognized they had to be at work, so we tried to make those accommodations as quickly as possible to assist with that.
Excellent. Anything you wanted to add, Corey?
Yeah, no, we have and I'll put it in the chat, a link. We have a web page dedicated to families to talk about COVID, to talk about all the things that are out there, resources and tips from our faculty on some things, things that are in different languages, of course, Spanish, Mandarin out here, especially on the West Coast with a lot of Chinese population, Arabic as well, and broken down to some of those. There's a whole site dedicated to that in terms of families and the resources around.
Great. Yeah, thank you for sharing that, Corey. Another question came through. What are your ideas for decreasing stigmatization of asking for support around mental health in the workplace? And I'd actually like to take a quick stab at this one. You know, I think many healthcare organizations partner with an employee assistance program or EAP. Lyra functions as an EAP replacement for large employers. So one of the things that we really recommend is education, having educational programming that is tailored to your particular workforce. So at Lyra, we have workshops and educational programs specifically for healthcare workers that acknowledge the unique challenges that they face in the workplace, the unique mental health consequences of those kind of occupational aspects, and then also the need to create a culture where people do feel like they can reach out and speak up. So the training there's training for individual contributors on how to notice within yourself that you need that support and how to reach out for it. But then there's also separate training for managers that gets them to recognize how employees might show up in ways that could signal distress and how to intervene in a way that's appropriate to your scope, to reach out to an employee, offer appropriate care and concern, and refer them to resources like the EAP in a way that's normalizing and validating. I really liked what Corey was mentioning earlier around executive testimonials and leaders speaking to hot button or really pertinent, urgent issues. So whether that's racial injustice or mental health, having someone who's high visibility, speaking to the importance of this topic, normalizing reaching out for resources, connecting it in some way to their own personal story, because that goes even further towards establishing their credibility. And then you have hopefully the start of a strategy where you're seeing it modeled at the top with your executive leaders. You're seeing it modeled by your managers with the manager training and the tools you're equipping them with. And then at the individual contributor level, many healthcare organizations are starting peer mental health champion programs, where employees who feel passionately about mental health, either as an advocate or someone who's impacted, go through their own training to kind of bring mental health into the conversation in team huddles, for example, or designate themselves as a resource for talking about mental health resources at the company should anyone have questions. So just thinking about it as everyone's responsibility, all levels of the organization, mental health should be pervading the conversation. But glad to get Katie and Corey to weigh in too.
Well, sure, and I think it's also keeping in mind the comfort, recognizing, the same way there's many generational differences throughout everything we do in the workplace, but recognizing that for accessing EAP, it may not be comfortable for someone to pick up the phone and make a call. They may prefer to have
Oh, Katie, I think we lost your audio. She might not be able to hear. Hopefully, Katie can rejoin us after her technical difficulty subsides. How about you, Corey? Anything you wanted to weigh in on there?
Yeah, and hopefully Katie won't think I'm talking over her while she's speaking. Yeah. But yeah, like yeah, we have some of the online stress reduction courses too that we offer our staff and members there, focusing on some of these things around that, and mental health is one of them. But we also have sort of a mindful meditations guide too, that led by our spiritual care teams that happen Monday through Friday at noon every day, 5 to 10 minutes about those types of things to help during some of the stressful times that people are having around them, that maybe also dealing with some mental challenges as well. So we have that going on a regular basis too.
Great. And Corey, we had one more question come through that I think speaks to something you specifically brought up: advice on how to get the most out of a pulse survey, how to get a better response rate from employees.
Yeah, letting people know up front that this your information, your input will guide where we go with certain things, and that we directly need your feedback to help us as leaders. And being sort of the humble approach as leaders, we don't know everything. We need your input to help guide us and guide some of the things, whether they be policy decisions, whether they be things around benefits, whatever they are, we need your input. And this will help guide the organization. So the more that you encourage your teammates to get involved, the better this will be for everyone going forward. And they have to be able to see that you actually did something with that information too as well. So showing them the data and then what you're doing, because if you don't, the next time you do it, they're like, well, they don't really care. They're just really kind of asking for our input because it makes them look good, but really they're not going to do anything with it. You have to show that you're actually doing something with the information.
Right. Excellent point. Only collect information if it's something you can actually take action on. Excellent. Well, I'm not seeing any other questions come through our chat at this time. A lovely comment, someone mentioning they love the idea of humility from the management team. So I'm glad that was a takeaway for that attendee. Well, barring any other questions coming through, since we only have 1 minute remaining, I want to just take this moment to thank our panelists. Such a wealth of information. You're very gracious in sharing a behind the scenes look at how your organizations got through a really difficult time and the strategies and tactical tools that you relied on to support your workforce and their mental health. I hope all of our attendees found this as illuminating as I did, and want to just reiterate that if your healthcare organization is looking for additional support around supporting the wellness of your teams, Lyra Health is glad to be a resource to you. Some of the stats that we talked about and findings from our report you can find on our website, lyrahealth.com. But just one more thank you to our panelists, and thank you to everyone who attended, and wishing everyone a good rest of your day. Take care.